Hello and welcome. Today we're diving into childhood-onset fluency disorder, more commonly known as stuttering. We'll explore what it is, what causes it, how it's diagnosed, and what can be done to help individuals who experience it. The exact cause of stuttering is complex and not fully understood, but it's generally considered to be a neurodevelopmental disorder. This means it relates to the way the brain develops and functions. Genetic factors play a significant role. Stuttering often runs in families. Research also suggests differences in brain structure and function, particularly in areas controlling speech and language, are likely involved. It's important to understand that stuttering is not caused by psychological trauma, nervousness, or poor parenting, although these factors can sometimes exacerbate the condition. At the neurological level, stuttering is believed to stem from disruptions in the timing and coordination of the neural pathways involved in speech production. These pathways connect different brain regions responsible for planning, initiating, and executing speech movements. Imaging studies have revealed differences in brain activity, particularly in the left hemisphere, which is typically dominant for language, and increased activity in the right hemisphere. These irregularities suggest a potential disconnect between the intention to speak and the ability to execute fluent speech movements. There might be issues with sensory feedback processing, leading to corrections and hesitations. Essentially, the brain's natural flow of speech is interrupted. Childhood-onset fluency disorder is relatively common, affecting approximately 5 to 10% of children at some point in their lives. However, the prevalence decreases significantly with age, as many children naturally recover. It's estimated that around 1% of adults stutter. Boys are more likely to stutter than girls, with a ratio of about 3 or 4 to 1. The core characteristic of stuttering is disruptions in the flow of speech. These disruptions can manifest in several ways. We see repetitions of sounds, syllables, or whole words like moo, my, or I want. Prolongations, where sounds are stretched out, such as sesnake. Blocks, which are pauses or moments of silence where the speaker struggles to get a word out. These disfluencies are often accompanied by secondary behaviors. These might include physical tension in the face, neck, or shoulders, eye blinks, head nods, or other distracting movements as the individual tries to overcome the stutter. Feelings of frustration, embarrassment, and anxiety are also common, especially as the individual becomes more aware of their stutter. Diagnosis is typically made by a qualified speech-language pathologist. The evaluation involves assessing the frequency and type of disfluencies in a speech sample. The speech-language pathologist will also look for secondary behaviors and assess the impact of stuttering on the individual's communication and social-emotional well-being. Importantly, the clinician will differentiate between normal disfluencies that all children experience and the more persistent and atypical disfluencies characteristic of stuttering. Parent interviews and observations in different communication settings are also crucial to form a holistic picture. While stuttering isn't formally classified into distinct types, the severity and presentation can vary significantly from person to person. Some individuals experience mild, infrequent stuttering, while others have more severe and consistent difficulties. The patterns of disfluency, repetitions, prolongations, or blocks can also differ. Understanding the specific characteristics of an individual's stuttering is vital for tailoring appropriate therapy. There's no cure for stuttering, but a variety of treatments can help individuals manage their speech and improve their fluency. Speech therapy is the primary intervention. Techniques include fluency shaping, which focuses on teaching strategies to produce more fluent speech, and stuttering modification, which helps individuals manage and reduce the severity of their stuttering moments. Cognitive behavioral therapy, CBT, can also be helpful in addressing the anxiety and negative emotions associated with stuttering. Electronic devices, such as delayed auditory feedback (DAF) or frequency altered feedback (FAF) devices, can sometimes improve fluency, although their long-term effectiveness varies. Support groups and self-help resources can also provide valuable emotional support and coping strategies. Currently, there are no definitive ways to prevent childhood-onset fluency disorder. However, early intervention is key. If you notice signs of stuttering in a young child, seeking an evaluation from a speech-language pathologist is essential. Early intervention can significantly increase the chances of natural recovery or successful management of the condition. The prognosis for stuttering varies. Many children, particularly those with mild stuttering, will naturally recover without intervention. However, for others, stuttering can persist into adulthood. Early intervention, consistent therapy, and ongoing support can greatly improve fluency and reduce the impact of stuttering on an individual's life. Research is ongoing to better understand the neurological basis of stuttering and to develop more effective treatments. Recent studies are exploring the role of specific genes and brain pathways in stuttering, as well as the potential for pharmacological interventions that target these pathways. Ultimately, the goal is to empower individuals who stutter to communicate confidently and effectively.